Ever wondered what really influences how long we live? Is it all in our genes, or could our everyday habits play a bigger role than we think? While genetics certainly set the stage, it's our daily routines, choices, and even seemingly small signals from our body that can make a huge difference. For example, did you know that certain itchy spots on your body could actually be warning signs of underlying health issues that might shorten your lifespan? Recent research has uncovered some surprising connections that could change the way you think about your health. In this video, we'll dive into what these mysterious itchy spots might be telling you about your body and how to take action to improve your health and longevity. Section 1. Itchy spots as warning signs. Have you ever experienced a stubborn itch that just won't go away no matter what you do? It might be easy to brush it off as dry skin or an allergy, but what if that persistent itching is actually your body's way of trying to tell you something important? Before you reach for another bottle of lotion, consider that certain itchy spots could be more than just a minor annoyance. They could be warning signs of something far more serious. Persistent itching is often seen as a superficial problem, like a reaction to a new detergent or a bout of seasonal allergies. However, if the itching persists for weeks or even months without relief, it could signal an underlying health issue that requires immediate attention. Itching is a symptom, not a diagnosis, and sometimes it can indicate conditions like liver disease, kidney problems, or even certain cancers. Our skin is the largest organ in our body, and when something is wrong inside, it often tries to communicate through signals on the outside, such as a chronic itch. Take the story of Mrs. Caitlin, a 58-year-old woman who began experiencing intense, unexplained itching on her arms and legs. At first, she dismissed it as dry skin caused by the changing seasons, but when over-the-counter creams and antihistamines didn't help, she knew something was off. Her itch persisted for months, often keeping her awake at night. After finally visiting her doctor and undergoing a series of tests, she received a shocking diagnosis: lymphoma, a type of cancer affecting the lymphatic system. Her persistent itching was one of the early symptoms, a signal her body had been sending for months, but it was initially overlooked. Mrs. Caitlin's story serves as a powerful reminder of the importance of listening to our body's signals. We often dismiss small symptoms, thinking they're insignificant, but sometimes they are our body's way of telling us something is seriously wrong. Ignoring these signs or postponing a visit to the doctor could delay the diagnosis of a potentially life-threatening condition. Paying attention to what seems like minor annoyances can lead to early detection, better treatment outcomes, and ultimately a longer, healthier life. There are several health conditions that might cause persistent itching, such as liver disease, where bile salts accumulate under the skin, or kidney failure, where toxins that should be excreted build up and cause itching. Even less common issues, like thyroid imbalances or iron deficiencies, can manifest as itchiness. The body is a complex system, and an itch might just be a clue that something more serious is going on underneath the surface. Our skin is not just a barrier against the outside world. It is also a sophisticated messenger for what's happening internally. The nerves in our skin are closely linked to our brain, and when something is wrong inside, the brain can signal this through sensations like itching. Think of your skin as an early warning system, alerting you to changes in your health. When you feel a persistent itch that doesn't seem to have an external cause, it could be your skin trying to tell you something crucial. The earlier a potential health problem is identified, the better the chances of successfully managing or treating it. Ignoring persistent itching or simply treating the symptom without investigating the cause can delay critical medical intervention. This delay can make a significant difference, particularly in cases like Mrs. Caitlin's, where early detection of lymphoma could have allowed for less aggressive treatment and a quicker recovery. If you're dealing with an unexplained itch that lasts for more than a few weeks, don't hesitate to consult a healthcare professional. Keep a record of when the itching occurs, any additional symptoms, and what remedies you've tried so far. This information can help your doctor make a more accurate diagnosis and determine whether further testing is necessary. Don't just rely on over-the-counter treatments or home remedies. Persistent itching deserves professional attention. Adopting a preventive mindset is crucial for long-term health. This means staying vigilant about unusual symptoms and not ignoring changes in your body. Regular checkups, awareness of your body's signals, and prompt medical consultations can help catch serious health issues early on, sometimes even before they develop into something more dangerous. Remember, your body communicates with you constantly. Are you listening? In conclusion, don't dismiss persistent itching as just another daily nuisance. While it may seem like a minor inconvenience, it could be your body's way of signaling an underlying issue that requires urgent attention. Just like Mrs. Caitlin learned, sometimes that itch is more than skin deep. Your health is your most valuable asset, so take every signal seriously. By paying attention to these small signs, you could make a big difference in your quality of life and your lifespan. Section 2. Could itchy skin be a sign of cancer? Have you ever wondered if an innocent itch could mean something more serious? While it may seem surprising, certain types of persistent itching can actually be linked to more severe health conditions like cancer. Before you dismiss that constant urge to scratch as just another skin irritation, it's important to understand how our body might be trying to alert us to a hidden danger. One of the lesser-known connections between itchy skin and a serious condition is lymphoma, a type of cancer that affects the lymphatic system. Lymphoma can cause a range of symptoms, and in some cases, itching, also known as pruritus, can be one of the earliest signs. This happens because cancer cells can release substances that trigger an inflammatory response in the body, causing the skin to itch. While not everyone with lymphoma will experience itching, it's a symptom that shouldn't be ignored, especially if it persists without an obvious cause. So, when should you be concerned about itching as a potential indicator of something more serious? If your itching is persistent and doesn't improve with over-the-counter treatment, it's time to consider a deeper cause. Itching associated with lymphoma often doesn't respond to common treatments like antihistamines or moisturizers. Additionally, if the itching is accompanied by other symptoms, such as unexplained weight loss, swollen lymph nodes, a low-grade fever, or night sweats, it's critical to consult a healthcare provider as soon as possible. Early detection is crucial in the case of lymphoma and other cancers, as it significantly increases the chances of successful treatment. If you're experiencing persistent itching along with other warning signs, getting evaluated by a healthcare professional could make a life-saving difference. Identifying cancer at an early stage often allows for a broader range of treatment options and can prevent the disease from progressing further. Along with persistent itching, there are several other symptoms that may indicate a more serious condition like lymphoma. Keep an eye out for swollen lymph nodes that feel firm and do not disappear over time, unexpected weight loss, ongoing fatigue, low-grade fevers that come and go, night sweats that drench your sheets. If you notice any combination of these symptoms along with unexplained itching, it's important to take action immediately and seek medical advice. Remember, your body is constantly communicating with you. Don't ignore its signals. Section 3. Areas of itchy skin that require special attention. Did you know that where you feel an itch on your body can reveal a lot about your health? From your armpits to more intimate areas, certain spots that itch may be trying to send a warning signal. Understanding the potential causes behind these specific itches can help you catch health issues early and take the right steps to address them. Armpits, the hidden connection between itching and diabetes. Let's start with a spot that might surprise you: your armpits. Itching in this area can sometimes be more than just a result of shaving or a new deodorant. In fact, persistent armpit itching could be an early sign of diabetes. How? Diabetes can cause a range of skin problems due to changes in blood sugar levels, which may lead to dry skin and fungal infections, particularly in areas like the armpits, where skin folds trap moisture. The link between armpit itching and diabetes. When blood sugar levels are not well controlled, it can impact the skin's ability to retain moisture and fight off infections. The skin in your armpits is particularly susceptible because it is often warm and moist, ideal conditions for fungal growth. People with diabetes may develop conditions like candida infections, which can cause redness, itching, and even a burning sensation in the armpits. If you have persistent itching in your armpits, it's worth considering whether an underlying issue like diabetes might be contributing. Importance of early detection and management of diabetes. Recognizing the link between armpit itching and diabetes is crucial because early detection and management of diabetes can prevent severe complications. If you notice other symptoms alongside the itching, such as excessive thirst, frequent urination, or unexplained weight loss, consult your healthcare provider immediately. Early intervention can make managing diabetes much easier and reduce the risk of developing more severe skin conditions or other health complications. Monitoring health and managing symptoms. To better monitor your health, keep a close eye on any changes in your skin, particularly in areas like the armpits. Regularly inspect these areas for signs of infection, discoloration, or persistent itching. If you have diabetes or suspect you might be at risk, maintaining stable blood sugar levels through diet, exercise, and medication is key to preventing skin-related issues. Always communicate openly with your healthcare provider about any unusual symptoms you notice. Anus. Understanding anal itching and its causes. Now let's address another area that often gets overlooked due to embarrassment: anal itching. Anal itching, or pruritus ani, is relatively common, but persistent itching in this area can sometimes indicate more than just an irritating rash or poor hygiene. Hemorrhoids, fungal infections, and even anal cancer are potential causes. While these conditions vary in severity, persistent symptoms should never be ignored. Causes of anal itching. Hemorrhoids are a frequent cause of anal itching. They occur when the veins around the anus become swollen and inflamed, leading to itching, discomfort, and even bleeding. Another common cause is a fungal infection, particularly in people with diabetes or those who are overweight, as these conditions create a moist environment that promotes fungal growth. However, in some cases, persistent anal itching can be a sign of anal cancer, a rare but serious condition that requires prompt medical attention. Seeking medical attention for persistent symptoms. While anal itch might feel like a minor inconvenience, it can indicate a more serious health issue, especially if it persists for an extended period. If you experience chronic itching, pain, or any other unusual symptoms around the anus, it's essential to seek medical advice. Early diagnosis can help identify the cause of the itching and allow for appropriate treatment, which could range from simple lifestyle changes to more intensive medical intervention. Overcoming embarrassment. Encouraging open communication with healthcare providers. Many people feel embarrassed discussing anal itching with their doctors, but it's vital to overcome this discomfort. Remember, healthcare providers are trained to handle all kinds of health concerns, including those that might feel awkward to talk about. Open communication is key to getting the right diagnosis and treatment. Don't let embarrassment stand in the way of your health. Speak up and share all symptoms with your doctor. Genitals. Why itching in intimate areas matters. Next, let's discuss itching in the genital area, particularly in older women. As we age, our bodies undergo various changes, and one of them is a decline in estrogen levels. This hormonal shift can lead to thinning and drying of the vaginal walls, a condition known as vaginal atrophy, which can cause persistent itching, discomfort, and even pain. Causes of genital itching, particularly in older women. Genital itching can result from several causes, including infections, allergic reactions, and hormonal changes. For older women, one common cause is vaginal atrophy, where the skin becomes thinner and less elastic due to decreased estrogen. This condition can make the area more susceptible to irritation and infection. In addition, conditions like lichen sclerosus, a chronic skin disorder, can cause itching and white patches around the genital area. Importance of early identification and treatment of gynecological issues. Ignoring genital itching, especially in older women, can lead to further complications such as urinary problems, painful intercourse, or even an increased risk of infections. Early identification and treatment are crucial to prevent these issues from worsening. Treatments can range from hormonal therapies to lifestyle changes and specialized ointments. The sooner you address these symptoms, the easier they are to manage. Reducing stigma. Encouraging discussions about genital health. Talking about genital health can be challenging due to cultural and social stigmas. However, it's essential to break this silence and encourage open discussions about these issues. Genital itching is a common problem, especially as we age, and should not be dismissed or ignored due to embarrassment. By talking openly about these symptoms with healthcare providers, you can receive the support and treatment you need to maintain a healthy and comfortable life. Empower yourself, recognize the signs and take action. Knowing which areas of itchy skin require special attention can empower you to take proactive steps toward your health. The armpits, anus, and genitals are not just sensitive areas. They are also key indicators of underlying health conditions. By paying attention to persistent itching in these areas, you can catch potential health issues early and address them before they become more serious. Final thoughts. Trust your body's signals. Remember, your body is always communicating with you, even in subtle ways. An itch might seem like a small, everyday nuisance, but it could also be a clue to a more significant health issue. Don't ignore these signs or be afraid to seek help. Trust your instincts, pay attention to your body, and consult a healthcare professional if something feels off. Your health is worth it. Share your experiences. If you've ever dealt with persistent itching in these or other areas, consider sharing your experience in the comments. Your story might help others feel more comfortable discussing their own symptoms and seeking the medical attention they need. Remember, awareness and open communication are the first steps toward better health for everyone. Section 4. Dry itching versus damp itching. Have you ever wondered why some itches feel dry while others feel damp or sticky? Understanding the difference between these two types of itching can provide valuable insights into your body's health and help you take the right steps to find relief. Dry itching. Causes and symptoms. Let's start with dry itching, which is characterized by a sensation of dryness, flakiness, and sometimes tightness in the skin. This type of itching is often caused by environmental factors such as cold weather, low humidity, or overexposure to hot water. In some cases, dry itching can also be linked to conditions like eczema, psoriasis, or age-related skin changes. The skin may appear rough, cracked, or even show small white scales. The importance of hydration and moisturizing. To manage dry itching, one of the most important steps is staying hydrated. Drinking plenty of water throughout the day helps keep your skin cells hydrated from the inside out. Additionally, using a good moisturizer regularly can create a protective barrier on the skin, locking in moisture and preventing further dryness. Look for products that contain ingredients like ceramides, hyaluronic acid, or glycerin, which are known for their moisturizing properties. Managing dry itching with simple habits. Avoid hot showers or baths, as hot water can strip your skin of its natural oils, worsening the dryness. Instead, opt for lukewarm water and limit your bathing time to no more than 10 minutes. Pat your skin dry gently with a towel and apply moisturizer immediately afterward to seal in moisture. Remember, keeping your skin well moisturized is not just about comfort. It can also prevent cracks, fissures, and infections that may occur if the skin becomes too dry. Damp itching, the hidden connection to liver and kidney function. Now, let's talk about damp itching, which feels sticky, clammy, or moist to the touch. Unlike dry itching, damp itching is often related to internal health issues, particularly involving the liver or kidney. These organs play a critical role in filtering toxins and maintaining a balance of fluids in the body. When they are not functioning properly, excess moisture or dampness can build up in the body, leading to damp, itchy skin. How liver and kidney problems cause damp itching. Liver and kidney issues can disrupt the body's natural balance, causing fluid retention and an accumulation of toxins that can manifest as damp itching. For example, when the liver is unable to process and eliminate toxins efficiently, they may accumulate in the skin, causing irritation and a persistent damp itch. Similarly, when the kidneys are compromised, they may not regulate fluid balance effectively, resulting in excess moisture that can create a damp, clammy sensation on the skin. Tips for maintaining overall health and managing damp itching. To manage damp itching, it is essential to support the health of your liver and kidneys. Start by drinking plenty of water to help flush out toxins and maintain fluid balance. Consuming a balanced diet rich in fruits, vegetables, and whole grains can also promote liver and kidney health. Additionally, avoid excessive alcohol consumption and processed foods, which can place extra strain on these vital organs. Incorporating herbal remedies and lifestyle changes. Herbal remedies such as dandelion, milk thistle, and turmeric are known to support liver function, while herbs like nettle and parsley can promote kidney health. However, always consult with a healthcare provider before incorporating any herbal supplements into your routine, especially if you have pre-existing conditions. Regular exercise and adequate sleep are also crucial for maintaining overall health and reducing dampness-related skin issues. Listening to your body's signals. It's important to pay attention to your body and notice whether your itching feels dry or damp, as this can provide valuable clues about your overall health. Persistent dry itching may suggest a need for better hydration and moisturizing, while damp itching could be a sign that you need to support your liver or kidney function. By tuning into these subtle signals, you can take proactive steps toward maintaining your health and comfort. Final thoughts. Taking charge of your health. Whether your itching feels dry or damp, understanding the underlying causes and taking appropriate action can make all the difference. Remember, your skin is your body's largest organ and often the first to show signs of internal imbalances. Keep it hydrated, nourish your body from within, and stay vigilant about any changes. When in doubt, seek advice from a healthcare provider to ensure you're addressing any potential health concerns early on. Thank you for joining me today, viewers. I hope you found this information helpful and insightful. If you did, make sure to comment 9 if you learned something new or 0 if you knew it all along? Yay.